Welcome to Health Options with me, Rabi Abdullah. The National Guidelines on the Control and Management of Sickle Cell Disorder was created 6 years ago in line with the World Health Organization strategy. The strategy aims to increase individual and community awareness of sickle cell disorder and strengthen planning, prevention, reduce disease incidence, morbidity and mortality, as well as improve quality of life. I have as my guest a sickle cell sufferer and advocate who will be joining me in the studio for insights into the national guidelines and pressing issues such as the call on the need for the re-evaluation of the strategy. There are increasing fears that COVID-19 could impact the fight against malaria, which is endemic in this part of the world, with its attendant high mortality and morbidity, especially among children under 5 and pregnant women. Another source of concern is the misconceptions about the links between malaria and COVID-19, such that some people ignorantly dismiss COVID-19 with a mere wave of the hands, describing it as a form of malaria. We intend to set the records straight and the dangers of self-medication on this episode of Health Options. Glad to have you join us on the program. You are watching Health Options, the program that not only tracks government policies on health, but help you to make informed choices about your health. Our policy track segment is taking a look at the national guidelines on the control and management of sickle cell disorder. The discussion is from the perspective of a sickle cell sufferer and advocate, Sharon Brown Peter. She is the president of a sickle cell advocacy group known as the Cells of a Generation. Hello Sharon, welcome to Health Options.
Hello, thank you for having me.
By the way, you look great.
Thank you so much, Sudi.
All right, so start by telling us, the burden, what it feels like for a sickle cell sufferer living in this part of the world.
Well, I was born and raised in the UK, and I moved to Nigeria in 2008. And the number one thing that I found out was a huge burden for me and my family was the financial aspect of the condition. There's so many bills to pay when I'm suddenly ill and I have to be rushed to the emergency ward. And I'm lucky enough to have a family that can afford this, but I had to think about all the people that cannot afford adequate healthcare, not just when we're sick, but also when we're not sick. So, for example, once in a while, I do have to go and check my blood, my blood to see if the levels are low or high. Check my eyes. Sometimes I do have to travel out to find out if there's anything else I need to look at. Like recently I found out that I have 9 centimeters of dead bone in fact on my left leg, and I wasn't able to find that out here because it would have been too expensive here, while NHS in the UK is actually free. So this burden is a lot on so many families, and that's why I started Cells of a Generation, so that I can see what can be done with NHIS, maybe for health insurance and other bodies that can help lessen the burden.
Okay, we know that Nigeria as a country accounts for the highest sickle cell disorder burden in the world. You know, they call it a black man's disease, but unfortunately our country accounts for the highest burden in the world. And for one who wears the shoes, knowing exactly where those shoes pinch, you have just shared your own story. And now you are at the forefront in the advocacy for Nigeria to re-evaluate the national guideline. What are those gaps that should be closed?
Well, first of all, the current data that we have for sickle cell is dated back to 2008, and this was conducted by WHO, and unfortunately we cannot rely on this information. For example, the information conducted by WHO in 2008 states that 150,000 children are born every year with sickle cell disease. We do not know if that number is getting higher or lower due to all the efforts, the accumulated efforts of the government and the NGOs that deal with sickle cell.
That's because of the absence of data.
The absence of data is a huge problem because we cannot track. There's no system to see what is happening. Also, the newborn screenings has not been fully implemented in all states in Nigeria. This is also another problem because children are finding out that they have sickle cell at ages 6, and this is where when a person with sickle cell is very young, this is when you would have problems with their development because of sickle cell, and that's why it's very crucial and important for them to know when they have sickle cell at a very, very young age. So that is also another one, and I believe that everyone in Nigeria should have information on their genotype. This could be implemented through our national identification system or any other regulatory system that would identify who you are. Are you SS, or because we know that SS and SS are
not compatible.
Yeah, they're not compatible. SS and AA are compatible. So these are things that we all need to know. And the final thing is also having a proper system for genetic counseling. There are lots of NGOs that are doing amazing work in this field. However, having it in a systematic way, because the end of this disease will start with public education, and that's the issue that we have been fighting for many, 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 many years, and we're hoping that in 2020 the government will finally listen.
For sickle cell sufferers, how would you describe it? Since once in a while you are in and out of the hospital, what is the follow-up care like?
The follow-up care is not as structured as we would like it to be. Unfortunately, I have to compare my follow-up care in the UK and the follow-up care here. In the UK, I am constantly given letters every 3 to 6 months, saying that I need to come into hospital to check my blood, to check my brain for any stroke symptoms, to check my bones, to check my eyes, because these are the general issues. I've had my gallbladder removed, and that was due to a follow-up check that I had when I was well, and they had realized that I had gallstones. And as time went on, the pain was severe, so I had to eventually take out my gallbladder. But it could have been worse, and I could have actually died if I did not check this early on. So follow-up care is a huge problem that we actually do need to solve in outpatients in federal hospitals. And it should be done every 3 months, 6 months. There are varying lengths for each check.
Okay, these are areas the re-evaluation of this guidelines should take into consideration.
Yes.
Okay. What exactly is the focus of your NGO as an advocate?
So recently we created this comic book. It's basically a form of genetic counseling, and it debunks all the myths that you might have, or people with sickle cell might have. For example, it's shown that people say, that people with sickle cell do not catch malaria, that we never fall sick from malaria, but this is highly, highly not the case. In fact, malaria is actually one of the main reasons why I would go into the emergency ward with pain, because my body is fighting this infection, which means that my blood count is dropping, and when my blood count drops, that causes pain for me. So that's one of the myths. Also, we talk about how emotional stress with sickle cell can also affect how often we fall sick. Like when I was younger, I was bullied quite a lot. I was very quiet.
By your schoolmates? Or?
Yes, by my schoolmates.
Okay.
I was very shy, and that I used to cry all the time, and because of the crying, I would fall sick, and that was an emotional trigger that my teachers were unaware of. So there's so many things that are covered here, but also the DD project covers real life stories from warriors. We recently launched the Cells of a Generation Writers Prize, so that people can send in their stories and they can share them with the DD project. So
is it restricted to sickle cell sufferers alone?
No, there are also people that are AS that can send in their stories, or people or family members such as siblings or anyone that's had a close relationship with a warrior. They can contribute to the DD project.
We're in a period talking about the COVID-19 era.
Yeah.
It's ravaging with its attendant effects. How has it been? What feelers have you been getting as it affects people living with sickle cell or sickle cell sufferers?
Yes, well, people with sickle cell are the most vulnerable to this disease because our immune systems are naturally very low compared to someone who is AA. So this means that we should, of course, follow the protocols, stay indoors. But from what I've seen online, there are emergency cases where some warriors have gone into hospital, and unfortunately they catch COVID-19.
Oh, they contract it from the hospital.
Yes,
wow.
that was in the earlier days.
Okay.
Now there's more control, but they contacted it in the hospitals. But I haven't heard anyone who has been diseased or died from COVID-19, which is good news, but it's still important to take the precautions as much as possible. So wear your face mask whenever you go out. And
okay, aside that, what other health education would you like to share with sufferers out there?
Well, I think it's very, very important to know your triggers. I have certain triggers that affect me and cause pain. For example, yesterday I slept in the AC all night. In the morning, of course, I woke up with pain, and that's something that we have to keep being aware of. Taking medication, multivitamins every day is very important. Staying away from cold. Emotional triggers as well. Try and make sure you keep your peace. I also say meditate as much as you can, so that nothing is worrying you. So a positive lifestyle, definitely, and state of mind, yes, counts a lot. It does. It does. It very much does. And just managing yourself, knowing yourself inside out, is very important. Wow. On a final note. Sound it out there to policymakers, since this has to do with re-evaluating the national strategy. Yes. What will be your last words? Yes, so re-evaluating this Nigeria's sickle cell strategy is very, very important now, because things have changed. There are new ways that we can control this disorder. There's hydroxyurea that should be available to all warriors. What did you call it? Hydroxyurea or hydroxycarbamide is their two names. Can you break it down? A hydroxycarbamide. It's basically a new drug that helps lessen the pain. It does have to be taken every day. It's like you have to take it for the rest of your life, but it basically turns your blood warrior's blood into fetal hemoglobin, which accepts oxygen more, and you basically sickle less. So that's a new drug that I'm literally forced to take in the UK, but here it doesn't seem to be well known. Also, I take astamine. Astamine is a very good multivitamin that does not have iron.
Oh, astamine, is it a blood tonic?
Yes, it is, but it does not have iron. People with sickle cell should avoid iron at all costs.
Okay.
Yes, so there are many ways that this strategy document should be changed and reevaluated over the next coming months, and I hope that I could play a part in that.
Okay, the medication you mentioned, is it, how affordable is it?
Right now in Nigeria, it's not affordable. From what I know, I don't know the exact price, but I know that it's not highly accessible either. There are a lot of families.
It's not easily accessible.
Exactly. I don't know. I don't think there are a lot of pharmacies that carry it. So that needs to be something.
Isn't that an irony? For a country that accounts for the highest burden of sickle cell disorder? It's not private, or warriors over here can't access such drugs. What does that mean to you?
It's sad. It's sad, but I think...
But is it even available?
It is available. I've seen...
So it's the affordability that's the issue.
Yes, it's affordability, but also, for example, I don't think my local pharmacy carries hydroxyurea.
Oh, okay.
Yes, that's an issue. There's so many issues with this, but I think that policymakers do have to sit down and really think about this, because it is possible to end the burden of sickle cell. Sorry, I don't mind if, do you mind disclosing your age? How old are you? I'm 24.
Wow, you look great anyway.
Thank you
of course, for people with the wrong notion that sickle cell sufferers don't live beyond certain age, I think, because I've seen those who had lived to be 65, 68.
Yes, it's possible. It's just management. If we're able to manage our condition well, for example, I was looking after my health from the age of like 2 when I started actually having a crisis. My mom would take me to the hospital. She would read about what I need to do, drink loads of water. I would be forced water everywhere I go, and that helped with lessening my pain, and then over time I had to take responsibility, so my independence mattered so much to me, so I had to learn how to look after myself. And even when I went to university, it was a struggle for me, but that's how I learnt, I should take my medication every day, I should keep myself warm, and drink lots of water. And yeah, so that's very important, because it's always said that we have a particular look, but I feel like that look is because of management and how well we've been managed. Exactly.
Yeah. Like, you don't look like a sufferer, the warrior that you are. And in the face of COVID-19, a lot of young people, schools are still closed, and I'm sure for the entries, a lot of young people might be interested. So how can they be part of it? Get their brains working, and making their own contribution.
So if for now, this competition can only be accessible through Instagram. So our Instagram handle is COAG Initiative, and we're posting about it every day, so you should see it.
I'm going for that $100 prize. I'll show you. Thank you so much, Sharon, for being a part of Health Options.
Thank you for having me.
All right. A whole lot of discourse and misconceptions have revolved around malaria in COVID-19, especially in terms of diagnosis and treatment. Let's now join the nation's chief epidemiologist as he sets the record straight.
For malaria, The rapid diagnostic test is still working well, is still recommended. When you have fever, instead of you to begin to panic that what you have is COVID, go to the pharmacy, get rapid diagnostic test yourself and see if it is positive. Go ahead and treat yourself for malaria. Or you go to laboratories, they will evaluate you. If what you have is malaria, it may not be malaria, but other infection. I must tell you that even though we are talking about COVID, malaria is still killing. Acute respiratory tract infection is still killing. Diarrhea is still killing. Many other diseases are still killing. So it's not that all the diseases have transitioned to COVID. No. So when you are sick, seek medical attention. Then your health officer, through the questions, and will be able to situate the disease where it belongs. For rapid diagnostic test for malaria, you have two. You have the antigen-based and the antibody-based. Most countries are encouraged to use the antigen-based, which is the HRP2. For now, most of the tests that are available for COVID, most of the rapid tests, they are antibody-based. The one that you can do now, the one that is being promoted by NCDC through the guideline, is the molecular test. Use of polymerase chain reaction and going through the processes. So for now, no rapid diagnostic test. The use of chloroquine and many others, and in a situation like this, many individuals will come with magic cure, and it is dangerous. So don't let us live in panic. Once you are sick, don't show fear. Even the COVID, you can see that most people are recovering from the centers. People get infected, they get managed, and they go back to their normal lives. Don't rush to any medicine you don't understand, and ensure that you receive your treatment from designated centers across the states in the country. Use of chloroquine as a preventive measure or as chemoprophylaxis is not encouraged, because now if you look at the doses that are used for COVID, it's not the normal therapeutic doses you are using for managing malaria. And it's not one medicine that you can just continue to consume. Like I said, it has many other disadvantages. So you are not doing yourself any good by taking hydroxychloroquine. The only people that use hydroxychloroquine is as a chemo prevention, like people that are coming from countries where there are no malaria, and they are coming to a malarious environment like ours. You are placed on chemo prevention, which could be hydroxychloroquine when you are coming from US. But for us, you don't have any need to begin to use chloroquine. It's not helpful. Rather, you use other things that can help your immunity, safe medicine like vitamin C's, like has been said everywhere, but not the use of chloroquine. The country is actually waiting on the outcome of that WHO test. And even in Nigeria, NAFDAC has also approved that the study should be carried out by some individuals, some researchers, and I think the study is also going on. And all this WHO is going to bring together and make a statement.
This is where we end this episode of Health Options. COVID-19 is real, and failure to comply with the safety protocols puts you and the people around you at risk. A quick reminder that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Thanks for watching. Hope to see you again.